Hello and welcome to the Lafayette Club's online lecture series. My name is Henry Lafferty, and today I have the privilege of being joined by Dr. Michael Osterholm, with whom I'll be discussing the COVID-19 pandemic. Dr. Osterholm is Regents Professor, McKnight Presidential Endowed Chair in Public Health, the founding director of the Center for Infectious Disease Research and Policy, distinguished teaching professor in the Division of Environmental Health Sciences, School of Public Health, a professor in the Technological Leadership Institute, College of Science and Engineering, and an adjunct professor in the medical school, all at the University of Minnesota. From June 2018 through May 2019, he served as a science envoy for health security on behalf of the US Department of State. In addition to all of this, he's the author of 2 books, including the 2017 book, Deadliest Enemy or War Against Killer Germs. Dr. Osterholm, thank you so much for joining me today.
Well, thank you very much for having me. I'm glad to be here.
To start us off, it'd be great if you could give our viewers an insight into what your job as an epidemiologist entails, as well as the myriad avenues it's led you down, such as founding the Center for Infectious Disease Research and Policy at the University of Minnesota, as well as deciding to author 2 books.
Yes, well, thank you. First of all, I have had an interest in infectious diseases and being a medical detective, which is what an epidemiologist is in a sense, since actually I was a young boy. I happened to be born and raised in a small rural town in Midwestern United States here, in which I happened to be blessed to have had in that town a woman who was in every definition of the way a Renaissance individual, someone who had a master's in journalism, multilingual, and worked at the local newspaper as the editor there at the paper where my father worked. And she actually subscribed to a journal called the New Yorker. Some of you, I'm sure, are familiar with that magazine. And at that time, there had been a series of articles published every so many issues called Annals of Medicine. And it was written by Mr. Burton Roget, and they were really medical whodunit stories. And as a young boy, I started reading these. I became incredibly fascinated by the idea of being a medical detective. And so I knew even before I was in high school that this is what I wanted to do. And so be it. Here I am today. I came to graduate school at the University of Minnesota after undergraduate. I got my advanced degree work here, and at the same time began working at the Minnesota Department of Health. I worked there for 25 years as what was called the state epidemiologist, and built that program, and then went back to the University of Minnesota full time. I had been there throughout that entire time, also while at the health department. And then in 2000 came back and started the Center for Infectious Disease Research and Policy, and have built that into another unit of really looking at infectious disease research. So anyway, I've always been academic grounded, at the same time have been in the public health field and the government side simultaneously, and it's been a good opportunity to kind of, you might say, take academics to the real world and bring real world to the academics.
That's fascinating. To move on to the issue of COVID, one of the most pressing issues surrounding this pandemic has been that of a race to procure a safe and effective vaccine. What, in your estimations, are the main challenges we face in obtaining such a vaccine? And when do you think we can expect to have one?
Well, there are a number of challenges that are before us, and without a question, the most notable one is time. We need that vaccine yesterday, not tomorrow. As you can see what's happening around the world and the devastation that this virus is racking on American and all other countries' populations. The challenges around this is that this is basically a new infectious disease area for vaccine work. We've not created coronavirus vaccines in the past for humans, and as much experience as we have at vaccine research and development, this is a new area from the standpoint of understanding how these vaccines might work, what are the critical elements of the immune response that we have to have in order to protect someone against this virus. And probably most importantly is how long will the protection last? What's the durability of it? And so we're trying right now, I think, with an amazing array of activities in the United States, Europe, Asia, to try to find vaccines that will work if nothing else, give us at least short-term or intermediate-term protection, meaning it may not last for a lifetime, but even if we could get a couple of years out of it, that would be fantastic.
Mm-hmm.
The other thing we have to do is figure out just the safety elements of this. There surely has been some signals from previous vaccine work done with SARS and MERS to other coronaviruses that have surely caused public health challenges in the past. And there was some indication from those particular viruses in the work that there may be challenges with a thing called antibody-dependent enhancement, or basically another immunologic mechanism whereby if you have just a little bit of antibody from a previous immunization and it wanes over time, you may hit a level where if at the same time you do encounter the virus in the community, rather than protect you, that antibody isn't sufficient to do that in terms of its level, but it will cause a cascade of immunologic events to happen, which basically are very, very serious in terms of what they do health-wise. And so we want to be sure that we don't have this kind of antibody-dependent enhancement that occurs with this vaccine. And that's some of the research area that's really being pursued right now.
You mentioned there that it's possible that a vaccine may not confer a lifetime immunity. So if, let's say, we had a vaccine that conferred 3 months immunity or 2 years, a 2-year-long immunity, like you suggested, what public health measures would have to be put in place alongside that to aim for eradication of the virus? And if that would even be a possible outcome?
Yeah, great question. Yeah, and I think how you framed that is very helpful. First of all, we have no hope anymore that this virus will be eradicated. It's here. Just like HIV/AIDS, when it first showed up, it had already saturated the world in a sense, and we knew that it was here for a long term, even if we'd had a vaccine. And the same thing is true here. I can't imagine a time that we could simultaneously vaccinate all 8-point-some billion people, possibly 9 billion people soon on the face of the earth, in a way that the vaccine would be 100% effective and that it would prevent future transmission from going on, much as we did with smallpox. And so I don't have any hope that we'll eventually eradicate this. What our goal has to be is to get an effective vaccine as possible that lasts as long as possible, and then to be able to vaccinate the world at an interval that would protect most people. So if protection lasted several years, maybe once every 2 years, you have to vaccinate people. Now, there's huge challenges with that. And I've often said that a vaccine is just a vaccine. It doesn't really mean much till it's a vaccination. It's actually in someone's arm. And at that point, then we know that, we can likely stop the person from experiencing severe clinical illness for most diseases. And we know we can limit transmission around the world. What we don't have yet here is a plan for this vaccine, how it will be used. And when I say this vaccine, I'm really referring to in the plural. I think there'll be a number of vaccines that will come forward. They'll be licensed by different countries and used in different countries that will be protective, at least in some limited way. And so when I refer to vaccine, I'm really talking to right now, which is at least 12 to 20 products that could very well make the market in the next year to year and a half.
Okay. What would you say has been the most major flaws in the ways that the United States and I suppose the United Kingdom have responded to COVID-19?
Well, let me cover the United States first, and I'll make a few comments on the UK. The United States, I think, came into this with the idea that we're the United States, no infectious disease is going to knock us off our game. And there was a certain amount of arrogance, I think, that came from many different circles that, well, we'll just handle this virus. And of course, this virus isn't just going to be handled. It really is one that is causing severe, severe illness. It's readily spread by the respiratory route. And because we have some people who are asymptomatic and who are capable of transmitting the virus, it poses a real challenge in terms of trying to stop it. So what happened was, rather than do what other countries around the world did, or for that matter, even in the United States, the state of New York did, was when we had kind of a house on fire situation last spring, the countries who were really negatively impacted worked hard to shut down transmission, really shut it down by doing what they call shutdowns or lockups or lockdowns, any number of names, but basically brought the economy to a screeching halt. And what that did is it kept people from congregating outside their homes, et cetera. People were pretty much housebound. And that really slowed virus transmission down substantially. Well, we did that kind of in the United States, and then we didn't do it for very long. And surely by May, when the case numbers had fallen from 30 to 32,000 new cases a day to 20,000 cases a day, everybody said, we're done. Well, in fact, we weren't. And other countries in the world that continued to work hard to drive case numbers down with distancing recommendations eventually were able to get much better control of the situation. And now today they're reaping the benefits of that, even though we are seeing resurgence of virus activity in a number of countries around the world. Dealing with 20 to 60 cases a day sure beats trying to deal with 70,000 cases a day. And so I think that the United States failed miserably in that regard. We gave up before the virus gave up, and now we're paying the price for that. I don't see any other choice. We're going to have to go back and reconsider a kind of a lockdown or a way to minimize the virus transmission so that we can get it to a low enough level to do what a lot of the other countries are doing in the world. Now, I want to be clear, all the other countries in the world are still going to be challenged. We're watching case transmission today in places like Vietnam, Hong Kong, Tokyo. You've seen what's happened in Northern England just in the last few hours. There's any number of places in the world where this is going to continue to be a problem, and we're going to have to address it. There's no question about that. But it's, again, like I said, it's much easier to address it when you're talking about cases in the hundreds per day versus many, many thousands per day.
Okay. So which country, in your opinion, has responded most successfully to a COVID-19 outbreak?
If you look at the numbers, I have to say the United States, with the caveat that it's only the state of New York. After they were hit really hard in March and April, the governor of New York took it upon himself to really set up a very aggressive program to reduce transmission, to monitor it very closely. And when there were examples of cases increasing in some area, he was willing to put the kind of, the brake on. And so today, New York stands out as an island in the United States where case numbers have been flat. Last week, they even had a day where they had no deaths. And so I think that this is the model that if we could, we'd want to use that. Now, it's not perfect. They're going to continue to be challenged. Life isn't back to absolute normal in New York at all, but it sure beats the alternatives, what we're seeing right now. So I would say that's an example of where to look to or look for. I think Germany has done a quite remarkable job given their own limitations and the populations they've had to deal with where the virus has come in. Clearly, if all of us can only be an island, New Zealand has done a remarkable job. It sure makes it easier when you have 5.2 million people on an island to make that happen. But they too have done really remarkable work.
Although New Zealand, are they not going to face their own problem when they do open their borders and all of a sudden all of their people are exposed to this coronavirus and there's no herd immunity? None of them have had any vaccines if that should come about. Aren't they just kind of delaying the inevitable on some front?
Well, I think actually what they're trying to do is, you might say, wait out the storm. They're hoping that they can limit transmission inside of New Zealand and get a vaccine so that they can achieve this kind of population level of protection, this herd immunity and more, by actually having it occur as a result of vaccines and then opening up after that. I've heard nothing yet but the fact that they're going to wait it out until a vaccine's available and then try to deal with it. So I think that's a good approach. I do think we'll have vaccines early next year. How effective they are, we're not sure yet, but I think they will. And in that regard, I'm confident that they can actually get through this one and have really not had to experience a lot of the serious illnesses and deaths that other countries have had to.
So when you look at the response to this pandemic as a whole, are you optimistic or pessimistic regarding our ability to respond to a potential future outbreak of an even more deleterious infectious disease, such as an avian flu or something like that.
Yeah. Well, let me answer as every good academician would answer, okay? Yes, no, and maybe. First of all, I think that much of the world has done a remarkable job responding to this under very difficult circumstances, and again, they're not done. I think the United States is just beginning to experience the pain and suffering of this pandemic. I've often likened it, for those of us that come from the sports world, we're still in the earliest minutes of this game. We still got a long ways to go.
Mm-hmm.
And when you look at the United States in particular, we estimate that between 7 to 9% of the US population has already been infected by this virus. That's it, only 7 to 9%. So if you think of all the pain, suffering, death, and economic disruption that's occurred, it's occurred for only 7 to 9%. So the challenge is, what are we attempting to do? Well, we're trying to make it possible to not have to get to 50 to 70%, that level that would likely induce some sense of herd immunity, meaning it would slow down transmission, it wouldn't stop it. If we can do that without having to be human illness and death, wouldn't that be great? And so the challenge is are we going to have those successful vaccines you and I just talked about, say in the next year? And if we are, can we hold out to minimize illnesses until that time and then vaccinate everyone? And then at that point, hopefully have the answer that will mean that, we can protect the public. And at the same time, we're enjoying our lives. We're not just, shut up in our houses anymore.
You've spoken in the past about the inextricable link between climate change and our vulnerability to future pandemics. Could you talk a little about this and suggest how we can sort of bridge the gap between the public's perception of these ostensibly unrelated phenomena? Yeah.
Well, first of all, we haven't heard much about climate change in the last 6 months, have we? That's unfortunate because, in fact, climate change is still every bit as real, and it's a real significant challenge today as it was a year ago. The one thing, ironically, that's happened is with the slowdown in the economies, we've seen substantial improvements in air quality in a number of locations around the globe, and hopefully, as a result of that kind of sense of lack of activity, we actually can show that we can do something about climate change if, in fact, we just put our plans together and convince the public that, look, if you slow down the kind of everyday transportation activities, et cetera, you can really begin to slow down the greenhouse gas emission. Now, in terms of its relationship to the infectious disease itself and coronavirus, I don't think we've seen much hint yet that climate change has played much of a role here. We haven't seen any evidence of seasonality, meaning like spring, winter, fall seasons in either of the hemispheres. It's done what it's done in both during all times. I think the other thing is, though, that with climate change, one of the things that will be challenging is if we're going to see more hurricanes in the United States over the course of the next several months. We've already had one, that's approaching us today in Florida, one that had just landed in Texas last week. And so if we overlay a serious challenge with hurricanes in the United States, infrastructure, response capacity, it's already strained desperately because of COVID. This could make these kind of devastating problems even worse. And of course, we all are well aware of the ties today between increasing frequency of major hurricanes and global climate change.
I'd like to know where you stand, you and epidemiologists stand on veganism. We know that industrial animal farming has served as the primary source of novel infectious diseases in the past 10 years. But in addition to this, it also employs methods which are actually strengthening the diseases against the use of antibiotics. I have a quote from the Center for Infectious Disease Research and Policy website, which I'll read out for our viewers so they can kind of know what I'm talking about. Many infectious disease and antimicrobial resistance experts fear that excessive use of antibiotics in animals could ultimately harm public health by promoting resistance in zoonotic pathogens like E. coli or Salmonella. that cause infections in people, and by reducing the effectiveness of antibiotics that are also used in human medicine. The emergence of the gene MCR1, which confers resistance to the last resort antibiotic colistin, is thought to be linked to widespread use of colistin in Chinese pig production. And that's the end of the quote. Yeah. And then the end of my question. So in this way, industrial animal farming is not only to some extent creating the problem, but it's also inhibiting our ability to respond to the problem of the diseases. So with this in mind, is it not time that we try to abandon industrial animal farming and move towards a more plant-based future?
Yeah. Well, one of the challenges we have today with antibiotic resistance is clearly the food production side. And you've laid out exactly what we have on our site as part of what we call an antibiotic stewardship program effort, where we're trying to find ways to limit the use of antibiotics to preserve them for the future so that we don't have more drug resistance develop with their overuse. And clearly in the animal production area, this has been a huge challenge. Mm-hmm. The other challenge we have, however, though, is we need to feed the world. And the starvation and malnutrition are huge issues. It just so happens that the one animal species that helps us in terms of protein, at least poultry. Poultry is the fastest conversion of energy to protein that we have. And so one of the issues that confronts us is to basically deal with starvation, we have to figure out how can we put together the most green friendly, most usable way to develop food systems for the growing world population. And at the same time, deal with issues of if they're crowded together, we're going to have increased infectious diseases. And if we have increased infectious diseases, we're going to be using antibiotics on them. Mm-hmm. And so what do we do? In addition, a lot of the farming today where antibiotics are getting used is actually the small independent farmer, particularly in the developing part of the world. In low and middle income countries. And these are not operations that by themselves would just go away. If we said, okay, you can't do large operations, they'd still be there. So what we need to do is work with farmers carefully to understand what kinds of things can we do to help reduce the use of antibiotics. Number one, if animals don't need them, don't give them to them. Help educate farmers, particularly the smaller farmers, which make up actually sizably far in excess of what the large corporate entities do. And so how can we help them be wiser in what they do for husbandry practices? Because, and again, they don't want to spend money on or do something that could be detrimental to their flocks. They don't want to do something that doesn't make sense financially. It costs money to give antibiotics. So our job is to help them do that and to make sure that the animals also don't become sick then, which is an economic loss for them. I think the other piece to this as it relates to antimicrobial resistance is just understanding that not only should we not be using antibiotics in these animals when it's unnecessary, but what do we need to do to find other ways? For example, safer water. That has been a big challenge with animal production. What about the issue of not just antibiotic resistance with use of these antibiotics, but also what can we do for vaccines? Can we actually find ways to protect animals that's cost effective, that they don't have to use an antibiotic that then creates the resistance to begin with? So you've hit on a very important point. This is really a major challenge today with our food supply. We have to provide people food. How do we do that? And how do we do it safely? We worry very much about antimicrobial resistance in microbes in the agriculture area because it's just a matter of time before they end up in humans. And then if we see these really horrible strains developing in agriculture, we know it won't be long and there'll be a problem in humans too. So I think that this is going to take a lot more work. We're trying to help pioneer this area called antibiotic stewardship, where we help teach why preserving antibiotics is really in everyone's best interest. And ag has to play their role in this as they do use a lot of antibiotics.
Thanks. In your latest book, Deadliest Enemy or War Against Killer Germs, which was originally published in 2017, I wish I could hold up a physical copy of it for you, but it's been in the mail for over 2 weeks, so I had to kind of resort to the Kindle.
Sorry.
No. you set out a 9-point crisis agenda to prevent new infectious diseases from spreading and creating pandemics. Priority 2 is, and I quote, establish an international organization to urgently address all aspects of antimicrobial resistance. You go on to liken antimicrobial resistance to the problem of climate change in the sense that we are all effectively in the same boat. It does not matter where antimicrobial resistant viruses, bacteria, and parasites evolve, for they will spread everywhere, all around the world. Why is it then that we are yet to have such an organization, and do you think that one will emerge from this COVID-19 pandemic?
Well, let me just say, it's when I talk to people like you that I'm encouraged that we will have one. My generation hasn't done so well. I feel like I almost need to apologize to you and to my own kids. I have a son who's 38, a daughter who's 40. And I know we're turning the world over to all of you in a much, much more degraded condition than we received it. And one of the challenges we have is, why have we not done more with antimicrobial resistance? And I feel like us baby boomers have really not come to understand the critical issue of how we hand the world over to the next generation. If we did, we would be doing much, much more about antimicrobial resistance. We are on the edge of a post-antibiotic era, meaning we're almost where we were, 100 years ago, when we're looking at the first antibiotics being used and opening up that incredible opportunity for that 100 years to save a lot of lives because antibiotics were available. We're taking that away from you. We're taking it away from my grandkids, from my great-grandkids that will be born one day. And so I can't stress enough how important it is that we do follow through on this comprehensive response, this issue that we just talked about here of how do we deal with antimicrobial use, whether it be in humans or in animals. And so I'm going to turn this one back to you and say, okay, I'm ordaining you amongst others to help lead the way here, okay? Because we need that kind of leadership. And don't be afraid of pushing really, really hard on us old timers, okay? Okay. Hold our feet to the fire, because this is a really important effort that you've just highlighted here, and we need your help. Oh boy, do we need your help.
Well, on that note, I was going to ask if there was perhaps any advice you could give to ordinary members of the public who are not doctors or scientists, but are looking for something particularly salient that they could do to help win the war against killer germs in the future.
Just do what you're doing right now, being informed, understanding what the issues are, trying to learn, and then working with your policy bodies to say, so what can we do about this? Okay, I mean, in the United States, we have seen, for example, a major reduction in the use of antibiotics in various animal areas, including poultry. Why? Because the public demanded antibiotic-free poultry. And you know what? They figured out a way to do it, to largely grow these birds in large populations without antibiotics. So don't hesitate to push. Keep doing that. That's number one. You can make a difference. Number two, I think the long-term issues here are going to take a lot of what I would call policy leadership. I hope that we merge science and policy more and more all the time. As far as I'm concerned, good science should inform good policy. And from that should come kind of almost what I jokingly say, one of my favorite foods is peanut butter and chocolate mixed together. So it should be a food group, frankly. I think that policy is chocolate, science is the peanut butter, and we need them mixed together. And so I hope that more of your generation takes that issue on and raises the questions about what can be done, how it should be done, what should we do about it. And then, the last thing is, in this world of COVID we live in right now, this is tough. This is tough. I, in this country in particular, see so many people hurting, suffering miserably, losing family members, economically are destroyed, not knowing what's coming for the future. And while this may sound somewhat atypical and maybe, a little crazy coming from an old professor, but, we need to combat the pandemic of COVID-19 with a pandemic of kindness. And I hope everyone who listens to this just once a day does something kind for someone. You know, it doesn't have to be big. It doesn't have to be, oh, look how great I am I, but just do something kind for people every day. And if we all did that, think how we could help take some of that pain away of what this pandemic is doing. And so I charge you. This is your task now. Okay.
Okay.
I will be a little angel watching you on the tip of your
Okay.
shoulder here. Okay. So you and Rose need to get those acts of kindness out there and help all your colleagues, all your co-students there. If everybody did that every day, think what a different world it would be. And it doesn't take much. It doesn't take much to be kind. And so I think that's the best science medicine I can give you for the day.
Well, Dr. Osterholm, thank you so much for all of that. That was great.
Yeah. And, thank you to you. I when you sent the invitation to me to do this, obviously I was curious as to who and what you are. And I think that it's programs like this, and it's people who are involved in your generation that are going to, you give me hope for the world. I'm not always so sure I'm all that high in my generation and what we're doing. Okay. We're messing things up pretty badly. But I have hope in you. I have hope that, what you're bringing to the table can not only correct the mistakes that we've been making, but you can make the world a better place. And now's the time to start. So thank you for inviting me. Thank you for caring enough to want to know about these issues. And thank you enough for doing your homework to really know what you were talking about and to ask some great questions. Okay.
Well, thanks, but the pleasure is all ours.